Pharmacy internships in Australia are a vital step for pharmacy students and graduates to gain hands-on experience and meet the requirements for full registration as pharmacists. To begin a pharmacy internship, you must have completed an accredited pharmacy degree, either a Bachelor of Pharmacy or a Master of Pharmacy, from an Australian university or an overseas equivalent. International graduates may need to complete additional assessments or bridging courses to meet registration requirements in Australia. Pharmacy graduates in Australia are required to complete an intern training program, or ITP, approved by the Australian Pharmacy Council. The ITP usually involves a structured curriculum covering practical aspects of pharmacy practice, patient care, and ethics. Common providers include the Guild Clinical Intern Training Program, Monash University ITP, Pharmacy Society of Australia ITP, and University of Tasmania ITP. Internships can take place in various settings. Community pharmacies are the most common, where interns learn to dispense medication, counsel patients, and manage stock. Hospital pharmacies focus on more clinical aspects, such as medication management and working with healthcare teams in a hospital setting. Some internships may involve specialized placements in research, regulatory affairs, or industry settings, depending on availability and the intern's interest. Intern pharmacists in Australia must pass the Pharmacy Board of Australia's written and oral exams. These exams assess knowledge and skills in areas like pharmacology, patient communication, and ethical practice. Completion of the ITP and passing the exams qualifies interns for full registration as pharmacists. The internship typically lasts 1 year, and compensation varies by location and setting. Most pharmacy interns earn an hourly wage, typically between AUD 22.30 per hour in community settings, with hospital internships offering slightly higher rates. International pharmacy graduates may require a temporary graduate visa or a skilled work regional provisional visa to complete their internship and remain in Australia. Applications are typically made directly to pharmacies or through hospital programs. Many pharmacies begin recruiting for interns well in advance, usually the year before, so planning ahead is essential. To be eligible for a pharmacy internship program in Australia, you must meet several academic, registration, and potentially visa requirements. You must hold an accredited pharmacy degree, such as a Bachelor of Pharmacy or Master of Pharmacy, from an Australian university. These programs are accredited by the Australian Pharmacy Council and cover the core competencies needed for pharmacy practice. For international graduates, the degree must be recognized as equivalent to an Australian accredited degree. This often requires an assessment of overseas pharmacy qualifications through the APC, followed by further training or examinations if needed. Graduates must obtain provisional registration with the Pharmacy Board of Australia to start the internship year. Provisional registration allows you to practice under supervision and ensures you can meet the training requirements. To apply for provisional registration, you'll need proof of degree completion or eligibility, a national police check, and evidence of English language proficiency, usually by providing an English proficiency test score like the IELTS or OET if your education was not in English. All pharmacy interns must enroll in an APC-approved intern training program. This program provides structured learning modules, assessments, and support to prepare interns for the final registration exams. Enrollment in an ITP typically involves a fee and submission of relevant documents, and programs are usually delivered online with some in-person workshops. Interns can choose from a range of ITP providers, such as the Guild Clinical Intern Training Program, PSA ITP, or others. International graduates or students must hold a visa that allows them to work and complete the internship. Common visa options include the temporary graduate visa, which allows you to stay and work in Australia temporarily, and the skilled work regional provisional visa, which allows skilled workers to live and work in designated regional areas. Visa eligibility may vary, so it is essential to consult with Department of Home Affairs guidelines or seek advice from a registered migration agent. A national police check is a standard requirement to ensure eligibility for provisional registration and suitability to practice. This check is conducted through approved agencies and needs to be submitted as part of your registration application. Some pharmacy internships, particularly those in hospital settings, may require certain immunizations to comply with workplace health and safety regulations. Requirements vary by state and institution, so it is advisable to check with the specific placement provider. Ensuring you meet these prerequisites early is essential, especially if you are an international graduate, as some processes like provisional registration and visa applications can take time. The Intern Training Program, ITP, is a critical component of the pharmacy internship year in Australia. This structured program is designed to provide pharmacy graduates with the essential skills and knowledge needed for independent practice. The ITP is mandatory for all pharmacy interns in Australia as it equips them with practical and theoretical skills required for full registration as a pharmacist. It bridges the gap between academic knowledge and real-world pharmacy practice, covering areas like patient care, clinical skills, ethics, and pharmacy law. The ITP must be completed with a provider approved by the Australian Pharmacy Council, APC. Several organizations across Australia offer these programs, and interns can choose the one that best fits their needs and goals. Common ITP providers include the Pharmaceutical Society of Australia, PSA, ITP, the Guild Clinical Intern Training Program, Monash University ITP, and the University of Tasmania ITP. Each provider's curriculum may vary slightly, but all must meet the APC standards. The ITP usually combines online coursework, workshops, and assessments designed to test competency in different areas of pharmacy practice. The curriculum generally includes clinical pharmacy practice and patient care, dispensing and medication management, pharmacy law and ethics, communication and patient counseling skills, and pharmacotherapeutics and clinical case studies. Many programs include interactive workshops where interns can practice skills in a simulated environment. Workshops may include role-playing patient interactions, mock dispensing, or handling clinical case studies. Each ITP involves several assignments, case studies, or quizzes that test knowledge and practical skills. Some programs also include competency-based assessments in a pharmacy setting to ensure that interns can apply theoretical knowledge practically. Performance on these assessments often contributes to the eligibility for final registration. The ITP generally runs parallel with the intern's work placement, lasting around 1 year. Interns can start their ITP once they have obtained provisional registration and secured an internship placement. Most programs offer online modules for flexibility, allowing interns to balance their ITP coursework with their work in a pharmacy setting. Costs for the ITP vary by provider, but generally range from AUD 2,000 to AUD 3,500. Fees cover coursework, workshops, assessments, and study materials. Some employers, especially large pharmacy chains, may partially or fully sponsor the ITP costs for their interns as part of their employment package. Many ITP providers offer mentorship and support services, which can be highly beneficial for interns as they adjust to their new roles. This may include access to tutors, a peer support network, and online forums where interns can connect and share experiences. Additionally, most interns are also supervised by an experienced pharmacist at their workplace, who acts as a mentor and provides on-the-job training. After successfully completing the ITP and meeting work hours requirements, interns are eligible to take the Pharmacy Board of Australia's written and oral exams. Passing these exams, along with completing the ITP, qualifies interns for full registration as pharmacists. The ITP provides the structured education and guidance necessary for a successful transition from student to registered pharmacist in Australia. Pharmacy internship placements in Australia provide pharmacy graduates with supervised, hands-on experience in different pharmacy settings. These placements help interns apply their academic knowledge in real-world environments while completing the required work hours for full registration. Here are the main types of internship placements available. Community pharmacy placements are the most common option, where interns work in retail or chain pharmacies like Chemist Warehouse, Terry White ChemMart, or Priceline Pharmacy. Interns are responsible for dispensing medications and managing prescriptions, providing patient counseling on medications, including over-the-counter products, handling pharmacy operations such as stock control, ordering and inventory management, and educating patients on preventive health and administering vaccinations if trained and authorized. Interns develop key skills in customer service, patient communication, and practical pharmacy operations. They also become adept in product knowledge and medication management, essential for community practice. Hospital pharmacy placements offer a clinical environment and are typically within public or private hospitals. These internships are competitive due to the specialized clinical experience they provide. Interns review and manage patients' medication therapy in collaboration with doctors and nurses, participate in patient rounds to learn about medication adjustments based on clinical conditions, prepare and dispense medications for inpatients, including IV medications and complex therapies, and counsel patients on medication use upon discharge. Hospital internships emphasize clinical decision-making, team collaboration, and in-depth pharmacotherapy knowledge. Interns gain insight into managing chronic illnesses, complex cases, and multidisciplinary healthcare delivery. Specialized placements may include opportunities in the pharmaceutical industry, regulatory affairs, aged care facilities, mental health institutions, and research settings. In pharmaceutical industry placements, interns may assist with quality assurance, clinical trials, regulatory compliance, or product development. Internships in rural or regional pharmacies provide unique opportunities to work in underserved areas, often with support from the Rural Pharmacy Workforce Program. Interns engage with the community, including health education programs for local populations, work with a smaller healthcare team, often with greater autonomy and responsibility, and manage a broader range of patient conditions and treatment needs. Rural placements strengthen adaptability, independence, and problem-solving skills. Interns also gain experience in areas like chronic disease management and often have more direct patient contact. For community pharmacy placements, interns typically apply directly to community pharmacies. Large chains may have structured internship programs with formal application processes, while smaller independent pharmacies often accept interns on an individual basis. Most hospitals advertise their intern positions through centralized application systems or on their websites. Application deadlines can be early in the year, and applicants may need a strong academic record, letters of recommendation, and relevant experience. Specialized placements in the pharmaceutical industry or research are often competitive, with applications through specific companies or research institutions. Networking, academic performance, and prior experience can be crucial for securing these placements. Intern pharmacists in Australia generally receive an hourly wage, which varies by location and setting. Community pharmacy interns often earn around AUD 22 to 30 per hour, while hospital placements might offer slightly higher rates. In rural or remote placements, interns may receive additional incentives, such as relocation allowances or housing assistance, to attract candidates to underserved areas. When selecting a placement, consider your career goals, desired experience, and location preferences. Community pharmacy is ideal for those interested in retail or general practice, while hospital pharmacy suits those inclined toward clinical and team-based work. Specialized placements and rural opportunities offer unique experiences, but may require a strong interest or commitment to specific areas. Pharmacy interns in Australia benefit greatly from diverse placement options, each offering a path to build expertise and fulfill the requirements for registration as a pharmacist. In Australia, pharmacy interns must pass registration exams conducted by the Pharmacy Board of Australia, PBA, to qualify for full registration as a pharmacist. These exams assess the clinical knowledge, communication skills, and ethical understanding necessary for independent practice. The registration exams include both a written exam and an oral exam. These exams test the intern's ability to apply knowledge in real-world pharmacy scenarios and ensure they can make safe and effective decisions for patient care. Passing these exams is required alongside completing the intern training program, ITP, and necessary work hours for full registration. The written exam is a multiple-choice format, usually computer-based. It consists of questions covering essential pharmacy knowledge, including pharmacology, therapeutics, and clinical practice. Content covered includes pharmacology and therapeutics, which involves medication mechanisms, indications, side effects, and contraindications. Pharmacy law and ethics, which covers regulations governing pharmacy practice in Australia, including dispensing laws and ethical responsibilities. And clinical case studies, which require the application of clinical knowledge to solve patient cases. Interns are encouraged to review ITP materials, study pharmacy practice guidelines, and focus on high-yield topics like chronic disease management and medication safety. The written exam is typically offered several times a year at testing centers across Australia. The oral exam is a practice-based assessment where interns are evaluated on their ability to respond to scenarios they might encounter in a pharmacy setting. It includes a structured interview with case-based questions. Content covered includes patient counseling and communication, demonstrating effective communication and counseling for patients on their medications. Problem solving and clinical reasoning, which involves responding to clinical scenarios such as drug interactions or patient-specific contraindications. And ethics and professionalism, which includes situational questions to assess ethical judgment and professional conduct. Interns should practice patient counseling, review case studies, and develop skills in explaining medication use. Mock interviews or role plays with a mentor can be beneficial. The oral exam is offered after the written exam, and many interns take it toward the end of the internship year. The registration exams involve fees that vary by type and location. The written exam fee is around AUD 800, 1,000, while the oral exam costs approximately AUD 500, 700. The fees may vary slightly depending on the testing center and exam updates. To sit for the registration exams, interns must have provisional registration with the Pharmacy Board of Australia, enrollment in an approved intern training program, and completion of a significant portion of their supervised practice hours, usually over half of the required 1,924 hours. Exam registration deadlines are typically well in advance, so it's essential to apply early. Interns who do not pass either the written or oral exams may retake them, although there are limits on the number of attempts. Interns may have to wait for the next exam cycle if they do not pass, which could delay their registration. Therefore, thorough preparation is crucial to avoid setbacks. Many intern training program ITP providers offer additional resources and workshops specifically designed to help interns prepare for the exams. The Pharmaceutical Society of Australia, PSA, and Guild Clinical Training Program may provide study guides, mock exams, and review sessions. Using case studies, guidelines, and resources like Australian Medicine's Handbook, AMH, or therapeutic guidelines can be helpful for clinical scenarios. Upon successful completion of both exams, interns can apply for full registration with the Pharmacy Board of Australia. Full registration allows pharmacists to practice independently and marks the completion of the pharmacy internship program. Passing these exams is a significant milestone, ensuring that interns meet the competency standards for safe and effective practice in Australia. The duration and compensation of a pharmacy internship in Australia vary by setting, location, and employer. Here's a breakdown of what pharmacy interns can expect. The pharmacy internship program typically lasts 1 year for most interns. This includes completing the required 1,124 hours of supervised practice, equivalent to about 38 hours per week. Internships are generally full-time, but some flexibility for part-time work may be available depending on the employer. Part-time arrangements may extend the duration to meet the required hours. Most internships start early in the year, shortly after the completion of pharmacy studies, usually in January or February. However, exact start dates may vary by employer. Interns need to complete the 1,824 supervised practice hours as per the Pharmacy Board of Australia requirements, which must be done under the supervision of a registered pharmacist. The hours are divided between practical experience at the workplace and structured learning through the intern training program. Interns must meet specific milestones, such as completing a significant portion of their required hours before they can sit for the registration exams. Pharmacy interns in Australia typically earn an hourly wage that varies by location, type of pharmacy, and setting. Interns generally earn AUD 22.30 per hour in community pharmacy settings, such as retail chains like Chemist Warehouse and Priceline, or independent pharmacies. Interns in hospital pharmacies may earn slightly higher wages, typically around AUD 25.35 per hour. However, hospital internships are competitive and may not always be as widely available as community pharmacy positions. Based on a full-time 38-hour workweek, annual earnings for pharmacy interns range from approximately AUD 45,000 to 60,000. Pharmacy interns in Australia typically earn an hourly wage that varies by location, type of pharmacy, and setting. Interns generally earn AUD 22 to 30 per hour in community pharmacy settings, such as retail chains like Chemist Warehouse and Priceline, or independent pharmacies. To attract interns to underserved areas, some rural and remote placements may offer additional incentives, including relocation allowances or travel support, accommodation assistance or housing subsidies, and higher hourly wages to compensate for location challenges. Some employers may cover part or all of the costs of the intern training program, which can be a significant expense. Employers may also offer access to training workshops, conferences, and other professional development opportunities as part of the internship. Some internships, especially in large pharmacy chains and hospitals, offer pathways to full-time positions after the internship year. Employers often prefer to retain interns as they transition to fully registered pharmacists, creating continuity in the pharmacy team. In summary, the pharmacy internship in Australia is a year-long program that provides essential training and a pathway to full registration. Compensation is competitive, especially with rural placements that may offer additional benefits.